microbeans to the newborn, which will never be coming from a formula feed. And that is the reason why ma'am has already said time and again that the baby needs human milk, which contains all these. So it is either the best is mother's milk or a donor or an express breast milk from a wet nurse, which is available. So these are the various challenges which are faced in optimizing support for breastfeeding. So we'll be going through these questionnaire. So what is the importance of optimizing support for breastfeeding as a part of obstetric practice, as a clinician?
So the breastfeeding is nature's way of nurturing the child, and it creates a strong bond between the mother and the child, and it also provides opportunities for the child to develop sensory developments like sight, smell, hearing, taste buds. They are all developed when the child is with the mother. And the special fatty acids which are present in the breast milk, they also help in development of the brain, and the cognitive functions have been found to be much better if the child is breastfed. Like it has been seen that the IQ scores are to the tune of almost 8 times more than the non-breastfed infants. And also those children who are breastfed, they are less anemic because the bioavailable iron in the breast milk is very good. So from these slides we can see the breastfeeding is recognized as the optimal source of nutrition for infants, providing numerous benefits to both mother and child, such as protection against the child infections and malocclusion, increases intelligence, and probable reductions in overweight and diabetes. These all things have been already elaborated by ma'am. We are just it is just a repetition of all the things we've already heard. Breastfeeding gave protection against breast cancer and improved birth spacing, and also protects against ovarian cancer and type 2 diabetes to the mother. Obstetric practice plays a critical role in supporting breastfeeding, as it is often the first point of contact for new mothers and can provide guidance and resources to support breastfeeding. Optimizing support breastfeeding, as we can see from here, this chart, this signifies that the child who is breastfed is less likely to develop infections. There are less chances of otitis media because of the breastfeeding, and also the development of the child is much more. There is not excessive weight gain, which in turn helps in non-development of diabetes in future. Also, the children, they show better IQ, and there is increased bonding between the mother and the child. As far as the mother is concerned, her fertility is also taken care of because of the lactational amenorrhea, and she has less chances of excessive weight gain during the postnatal period. She also has to go less to the kitchen for making formula feeds. That is much more of an advantage rather than, so breastfeeding support responds to the needs of diverse populations, including those who may face additional barriers to breastfeeding, such as low-income women and women of color. It helps to ensure that all mothers have access to the support they need to successfully breastfeed. What are the Indian, Dr. Vandana, what are the Indian figures for breastfeeding incidence?
So India is among the world's 5 largest emerging economies, when investment in breastfeeding is significantly low, resulting in an annual economic loss of over $14 billion due to child deaths and cognitive losses caused from poor breastfeeding practices. This has been said by a report. In India, less than 50% of the children are breastfed within an hour of the birth, which is most important for continuation of the breastfeeding. If we want exclusive breastfeeding to be done successfully and adequately for the baby, the breastfeeding has to start in the golden hour. Exclusive breastfeeding can prevent nearly 10,000 deaths of children every year due to diarrhea and pneumonia. 5 countries, China, India, Indonesia, Mexico, Nigeria, account for over 236,000 child deaths every year because of inadequate breastfeeding, and we know why. Because the immunity is low, the children are more prone to respiratory infections, gastrointestinal infections, which can be so easily taken care of by mother's milk. UNICEF and WHO say that these countries together income and economic cost of around 120 billion every year due to mortality and cognitive losses, so which can be easily and very easily be prevented because breast milk is naturally present. So what are the the breastfeeding policy?
Breastfeeding policy.
So the breastfeeding policies would are the various model policy elements are in service training, which we are starting now. Ma'am didn't have, even we did not have. In our PG courses, we were not also taught. So I think it's only in the past 5 years, with the contact with Dr. Anita, we have come to know that these are.
Talking in detail.
Yeah, she is the one who has really inculcated in us that breastfeeding is a very important part. Prenatal breastfeeding classes that can be taken in antenatal period, and the husband has to support, asking about mother's feeding plan, initiating breastfeeding within 1 hour of uncomplicated vaginal birth or even cesarean birth. It is just a matter of showing the mother or your nursing staff that the baby has a very well set stepping reflex, which the baby crawls to the mother's breast if put on the mother's abdomen. Initiating breastfeeding after recovery of uncomplicated cesarean section and showing mothers how to express the milk and maintain lactation if separated from the infant in case the mother is sick or the baby has to be taken up in a nursery. Give only breast milk to the breastfed infants. Rooming in has to be there 24/7. We cannot say that the mother is to be separated, she needs rest, she's tired. No, this is the grooming in period for the baby and the mother as well. So she realizes that skin to skin feed will increase more and more psychomotor development of a baby and more emotional bonding with the baby. So the breastfeeding has to be on demand, it is not timed, and no pacifier. The breastfeed is not being used as a pacifier. She should never think that this is just acting as a pacifier for the baby, because the baby demands when the baby is very small, the moment it is put to breast, it goes off to sleep, because after a little bit of effort, the baby goes off to sleep. So it hasn't got the required amount of calories. It will wake up again and it will demand. So that is the demand feeding. And referral of mothers with breast problems to appropriate segments or healthcare facilities where it is required. So next would be, I would be asking Dr. Renu, what are the challenges faced by the clinician and mother while she is breastfeeding? So there are multiple.
The common challenges include lack of experience or information. As we see, the first time mothers, they have no clue how to hold the baby and how the nipple should be, how the latching should be done. So in this figure we can see how the latching should be done, where the position of the lips should be, and where the chin should be, and we have to take care of the nose so that the nose is not blocked. And next is pain. So some kind of pain, tactile sensation has to be there when first time feeding is given. So mother has to be counseled for that. She has to be taught about it, that first time feeding she may find some difficulties, but people have to help her. Health professionals as well as home people have to pitch in to make the first breastfeeding successful. Too little or too much milk. Initially no milk may be there, but as long as the child suckles, the milk starts coming. So this has to be put into their minds that milk may not be trickling down at the first time, but it will start coming once the reflex is there. Depression or anxiety. Sometimes after a prolonged labor or traumatic labor, mother may be into depression, or she may be anxious that because of her breast size or other problems, she may not be able to feed the baby. All these things have to be taken care of by the health professionals. Difficulty accommodating breastfeeding or pumping at the workplace. Once the breastfeeding is established, but she has to go for work also. Maternity leave is only for a short time. Though she has to be given the information that she need not put the baby on artificial feeds, she can express the milk by the help of breast pumps, and she can store it adequately and appropriately so that it can be used in her absence.
Almost a month, and that has to be the mother's milk does not require any boiling, and it can be just heated in a warm water. You don't have in a water bath rather. Never put the milk on the gas stove straight away. So it has to be done over a water bath.
Lack of support from family.
One thing I would like to add.
Yeah.
Water baths are also not recommended.
Yes.
Only keep it in the room temperature.
Because they have to keep it only because
Yeah.
Because water baths में भी कुछ antibodies जो हैं वो lose हो जाएंगे. So we have to just keep the milk at the room temperature for 1 hour and then we can feed. But in cases when the baby has demanded early, 1 hour is not there. That time she can heat it with the water bath.
That water bath should not be boiling hot.
Not regularly.
Yeah, not regularly. When it should not be boiling hot. So the temperature has to be controlled. Right.
Lack of support from family and community. Breastfeeding is a complex social and cultural behavior that may be influenced by family and community beliefs and practices, as we all know. Lack of access to lactation support. Many mothers may not have access to lactation consultant or other breastfeeding support resources, which can limit their ability to overcome breastfeeding challenges and achieve their breastfeeding goals. One of the most common thing is heavy breasts. So we have to imagine that if the size of the breast is very large, then it acts as a big sandwich. So we have mother has to be taught how she can manipulate that breast size so as it will not cover the baby's mouth, baby's nose, and it will not give discomfort to the child, and he can feed properly. So the next
Myths.
what are the myths about breastfeeding?
So many myths. Ma'am has already spoken about different myths, and they are really well prevalent, and they have to be really taken care of. And the medical practitioner, whatever the clinician says, is a golden word for the mother and the family, and they can always come to you back again and ask and get their myths allayed. These are just a few we are numbering. That one thing is that everyone says that breastfeeding is easy. It's not easy, but it has, the mother is also the first time mother, she is adapting, and the baby, yes, definitely the baby has a rooting reflex, so the baby can crawl towards the mother's breast and then start suckling and go off to sleep again. So it is a learning process for both the mother and the baby about the size, the way the baby is being held, the baby is being cradled, and the nipple is being fed to the baby. Your nipples, you need to wash the nipples every time. No, they are not to be washed every time, because the skin, healthy bacteria, as ma'am said, the gut biome of the baby is formed from the whatever the mother is providing. If it's a vaginal birth, it comes from vagina, plus additionally the skin also holds lots and lots of healthy bacteria, so they would be really beneficial if the baby gets them. Do not wash until and unless we have applied some cream or antiseptic because of sore nipples. You shouldn't breastfeed if you are sick. So that's a very big no. The mother can very nicely feed her baby, because the baby would get protected against the disease, because mother has already built those antibodies. And if it is a respiratory disorder, a mask can be used by the mother. In HIV, when the load is 0, she can very nicely feed the baby. So can't take any medications. Mother can easily take medications. These medications, if given by a clinician, they know which are crossing the which are crossing the breast barrier. So that is the reason why the mother can easily be taking her medications as and when required. Breastfeeding causes sagging. So this is again a misnomer, because breastfeeding rather shapes up the woman much better. If you are feeding, the mother is feeding from time to time, the breast will never sag, and the amount of milk which comes in the breast is appropriate to what the child is required. So it is never overfilled. And breastfeeding babies are clingy. No, this is the time when they are developing, they require that reassurance, and they become better individuals with better cognitive abilities and psychomotor development. It's hard to wean off the baby if the baby is breastfed. It's again a misnomer. As the baby's calorie requirements increase, the baby is bound to accept top feeds. Top feeds may be solid ones whenever required, whenever we are weaning off the baby. So weaning is never difficult. It depends how the mother is handling and how her support is handling at the house. So exercise will affect the taste of the milk. No, exercise does not have any role, and you can never use formula if you want to breastfeed. No, that is again a big no. Suppose a chance comes that the mother has to travel out and the baby has to be left behind, the baby can easily be taken over by express milk or a donor human milk. Still not possible, the baby can be put to a formula feed very easily. The baby responds to the demand the baby has. Shouldn't breastfeed if you're sick. We've already gone through it. Can't take any. Why? It's again. Acha, then next. So now I would be asking Dr. Renu, what are the causes of poor prevalence of lactation? Why the lactation is poor in many instances?
There are multifactorial reasons which include maternal age. If the age is more, she may be having less milk because she is not mentally prepared to feed the baby then. Body mass index, mode of delivery, duration of labor medications, use of non-breast milk fluids and or pacifiers. Like ma'am has mentioned, they want to give some sweet thing to the child first of all. So that may hamper, that may aid on poor lactation. Then hormonal imbalances, insufficient glandular tissue, and patients who have PCOS before pregnancy, they may also have poor lactation. So what are the factors responsible for no milk production?
So there would be many factors. There are times when there is no milk production and the mother needs a lot of support. First is that a prolonged labor is there, she's tired and she does not want to feed, she wants to take a little bit of rest. So with the help of her relatives, the baby can be put to the breast while the mother is resting. True primary lactation failure, as this ring says, that true primary lactation failure is only that smallest, minuscule part, it's which is shown. It's only less than 1%, and it could be again because of the hormonal issues, insufficient glandular tissue, breast surgery or injury, medical conditions like hypopituitarism. However, most cases perceived of no milk are due to issues with milk transfer rather than a complete absence of milk. So usually the mother perceives that there is no milk, but there is sufficient for the baby if she keeps on feeding. The milk production would be directly proportional to the amount and duration of feed the baby is taken. So what would be the factors responsible for delayed initiation of lactation? Delayed करें क्या? Yeah.
In India, delayed lactation is very, very common. It is because of the ritual reasons. So in some of the communities, they do not feed the baby for 5 days. Nowadays, because of the education and because of the teaching in the antenatal period, we are able to overcome to some extent, but still we need to work for so many months to teach all this, that for first, as the first breast milk is very, very important to prevent the diseases in the newborn, because they think the first milk which comes is the witch's milk. So it has to be taught to the mother as well as to the family members that first milk is the one which will prevent many diseases in the newborn. So the reasons are maternal or infant health issues, mode of delivery, medications used during labor or postpartum, and delayed lactation can put infants at risk of hypoglycemia, weight loss or dehydration. And in the mother, if she does delayed feeding, then she may have engorgement of the breast and the ducts may get plugged. She may develop mastitis and the long term may have to undergo IND for her breast abscess.
How to identify poor lactation?
How to identify poor lactation?
So we have gone through so many areas that poor lactation, if it is there, it will lead to poor breastfeeding. So the clinician has a very important role in identifying the causes which may lead to poor lactation. It could be inadequate milk production, ineffective latching or suckling. So because infant is the one, when the let down reflex comes, it comes from there only. And maternal health conditions such as obesity and hormonal imbalances. Signs of poor lactation would be the baby is not getting enough feeds, then the baby's weight would not increase and the baby's stools would be scantier. So insufficient gain in the baby, weight gain, reduced urine or stool output and inadequate milk transfer during feedings. So this is one aspect, and then the clinician has to do a breast examination. So that the breast examination is to assess for any issues such as engorgement, nipple trauma or signs of infection. We have to take the history, also inquiring into the mother's breastfeeding history, including any past challenges she had in her previous delivery. as well as any previous breastfeeding experiences with other children. So infant behavior also many a times, observe the infant behaviors during feeding which can provide clues about poor lactation, such as fussiness, irritability and sleepiness during feedings. And nutrition and hydration, healthcare providers should also evaluate the mother's nutrition and hydration status, as poor nutrition and hydration can affect the milk quantity and quality. Use of breast pumps. Healthcare providers may recommend the use of breast pumps to increase the milk production and support successful breastfeeding. Follow-up. Healthcare providers should provide ongoing support for follow-up. Thank you. Including monitoring of the infant weight gain and milk intake, addressing any concerns or challenges that arise, and offering continued education and support. So, it is important for healthcare providers to be able to identify cases of poor lactation early and provide appropriate support to prevent negative health outcomes for both mother and baby. Next, we go on to how to identify poor lactation cases.
First and the foremost is skin to skin contact. As we've already enumerated it enough times, that encouraging skin to skin contact immediately after birth and during feedings can help promote bonding, regulate the baby's body temperature and increase milk production. These are the various positions which one mother can use to feed her baby. Breastfeeding positions. Healthcare providers can demonstrate various breastfeeding positions such as the cradle hold, football hold or side lying position to help mothers find a comfortable and effective positions for feeding. Breast massage and compression. Encouraging mothers to massage and compress their breasts during feeding can help stimulate milk flow and increase milk production. Galactagogues are the substances that can help increase milk production. Examples include herbal supplements such as fenugreek and prescription medications such as domperidone. Supplemental feedings. In some cases, healthcare providers may recommend supplemental breastfeeding with formula or donor milk to ensure adequate nutrition for the baby. In the above photograph, we can see the cracked nipples are the most common causes of inadequate feeding. So to prevent cracked nipples, one should ensure that the latch is proper. And if the latch is proper, if the cracked nipple occurs, then the mother should try another position. In whichever way she feels less hurt, she should try and feed the baby in that position. And secondly, her own milk is sufficient to heal that crack. So she should be taught to apply milk after feeding the baby. The few drops of milk she should apply around the nipples so that cracks are not there. And she should also take care that nipples are moisturized all the time. Dryness also leads to cracking of the nipples. This is one of the most common causes why the feeding does not occur properly. So continual support, ongoing support and follow-up care are critical for successful breastfeeding. Healthcare providers should continue to mother milk supply and infant weight gain, address any concerns or challenges that arise and provide ongoing education and support. What are the roles of galactagogues?
So now we have come to an area where we can help the mother by giving her something so that her concerns about inadequate breast milk is taken care of. So galactagogues are maybe non-pharmacological or pharmacological drugs which can initiate, maintain and continue the milk production, which to the mother's satisfaction is more than enough for the baby. So these are increasing the milk supply. Primary role of galactagogues is to increase the milk production in lactating women and can be particularly helpful in mothers who have low milk supply, difficulty in breastfeeding, having a premature or sick infant. So the pharmacological ones are domperidone and perinom, which we are very commonly using. They are D2 receptor antagonists and they increase the levels of prolactin. And domperidone is supposed to be more better because it does not cross the blood-brain barrier and crosses the breast milk to the minimum quantity. Others, as already said, that herbal preparations could be fenugreek, or otherwise we have preparations coming in the market. So mechanism of action could be increasing prolactin level, enhancing milk ejection reflex, improving breast tissue development. So the roles of used in conjunction with other treatments, galactagogues are often used for poor lactation, where along with breastfeeding education, support, and correct positioning and latch techniques. So galactogogues will only initiate, but that continuation will depend on the mother and the baby. If the baby is getting properly latched and the baby is suckling, that suckling reflex is the one which leads to let down reflex and which leads to a stimulation of your pituitary, and oxytocin comes to help and increase the breast milk. So safety considerations would be, while galactogogues are generally considered safe, there are some potential risks, side effects, and medical interactions to be aware of. Therefore, it is important to consult with a healthcare provider before taking. So this is what, that besides the home or maybe the kitchen provided ones, the whatever the chemical or pharmacological drugs a lady takes has to be under the supervision of a healthcare provider. So evidence-based practice has to be there, where galactogogues have been used for centuries to treat poor lactation. There is limited high-quality evidence on their effectiveness, and healthcare providers should use evidence-based practices and consider the individual needs and preferences of the mother and infant when determining the appropriate use of galactogogues. Consideration of underlying cause is very important, because we cannot, the mother is having a sore nipple, she is unable to feed, the baby is not able latching on, and that is the reason of poor lactation. Galactogog was do nothing for her. So we have to see that she honestly needs. Ineffective breastfeeding technique is there, galactogog is not going to help her. Maternal and health infant conditions, if there are health conditions associated, we have to be very judicious in using, and psychological and emotional factors are always there. So I would say the take-home messages today would be, obstetricians and other healthcare providers should receive adequate training in breastfeeding support and management, which we lacked during our medical practice, and Delhi Gynae Forum through Madam's initiative is taking this role, and it's seen to us that we all are getting skilled healthcare providers. Healthcare workers should allay the maternal fears regarding various myths about breastfeeding, and it is important for healthcare providers to be able to identify cases of poor lactation early on and provide appropriate support to prevent negative health outcomes for both the mother and the infant. And to increase the milk supply, we can judiciously use the galactogogues, maybe pharmacological or non-pharmacological. Thank you.